Good afternoon, everybody. My name is Carolyn Byrne, and I'm Director of Governmental Affairs for Public Health. We want to welcome you today to the Alabama Public Health Training Network, where we're going to talk about the Back to School Toolkit, about the report card. We have a lot of issues to cover today, so we are glad you're here with us. Today we are going to have Kelly Stevens, who is sitting to my left. She is the Director of Infectious Diseases and Outbreaks Division in our Communicable Disease Bureau. We also have Dr. Karen Landers joining us by telephone, and she is our District Medical Officer and also our Pediatrician Extraordinaire. Dr. Mary McIntyre may be joining us in a little while. She had a conflict come up, so we apologize for that. So today we just want you to know that there is a toolkit that has a green cover. This is a toolkit we're working from today. However, next Tuesday, we are going to update the toolkit. It will have an orange cover in honor of Halloween. So look for the toolkit next Tuesday that will include these changes. And if you have any questions, please do not hesitate to reach out to me. Today we're going to cover, Kelly is going to cover the ADPH report card and some questions that you all have had on that. I am also taking questions, so feel free to email us. I will be checking the emails to address your questions. We also have some changes that we're going to be making to the toolkit, and there's one major change I'll discuss. We also will be covering frequently asked questions, and Dr. Landers will help us discuss some complex issues that you all have gotten in touch with us about. So, and then we'll review some isolation and quarantine guidance. When we put the toolkit together, and I think in our other trainings, we talked about this being a living document. Things are changing. I'm happy to say the mask order has helped. We've seen cases trending down. And so this is a living document, and we will make changes to this document based on CDC guidance and also on the spread of COVID-19 in your communities. So just know that this will not be the last change, but we will change the cover. Thanks, Kelly. So we all know that you all have been dealing with a whole lot in back to school, and we just want to say that we really, really understand the emotional, social well-being of the children, the safety of the faculty and staff and the children, the economic security issues that are coming up. This is an unprecedented global pandemic, and we hear you. We're trying to work with you. Jennifer Ventress is in the audience right now, and she and I are in constant communication. And we just want to thank all the school nurses out there who have worked tirelessly to protect the children and the faculty. And we just want you to know we hear you on that. So thank you so much for being here. And I just wanted, in the existing toolkit, we are listing the pages that we're going to be changing. So I just wanted you to know what pages will be changed. On page 6, we changed that because we had said children to bring their own lunches, but that's not possible with reduced and free lunches that we have, and a lot of our children are on that. So that will be changed. We're going to be changing page 9, 10, I think we have 11 now, 14, and we didn't list 11 up, that came up last night, and page 12. So the major new change is that we had 3 major symptoms. We had new cough, shortness of breath, and difficulty breathing. Those close contacts of those 2 major symptoms will no longer need to be sent home. And I think that is a major change in the toolkit today. Now, what about loss of taste and smell? Loss and taste and smell is really a very big COVID indicator. So we are going to keep that as a major symptom that you send close contacts home. If a child loses the sense of taste and smell, and Dr. Landers will be talking about this a little bit later, that is almost always COVID. The other change will be on page 14 that's related to these change in major symptoms. So look for next Tuesday posting an orange cover on the new Toolkit. And thank you again for joining us. And I'm going to turn this over to Kelly Stevens. Thank you, Kelly.
Thank you. Okay, so I'm going to go over the COVID-19 report card, which many of you are already familiar with this report card, but I'm going to go over it from start to finish and include the changes that we have made. Where can you find the COVID-19 report card? Most of our information is available on our website, and it's updated frequently, and our website is alabamapublichealth.gov. And to get to the report card, you have many options. For example, on the home page, you can click on the banner where it says the COVID-19 resources for schools. That same banner, there's an arrow that you can click through, and there's other coronavirus and COVID pages that the COVID-19 report card is available on. In the very middle of the home page is an How Do I section, and one of the How Do I's is Report COVID-19 Results. So you can get to this report card through multiple clicks. It's important to remember that this report card is used by many different providers and not just school nurses and schools in general. So it's not unique to schools. But we have added certain fields to make it easier for the school nurses to use. So the first field that you will get to when you click on the report card is reporting the actual case. What kind of case are you reporting? So there are two instances that you need to report. The first is a laboratory confirmed, a positive case, a case that has been diagnosed by your physician through a laboratory test. The second is, of course, reporting an ill student in your school. So if you are reporting a positive case, for example, a physician calls your office and says, I have a student that goes to your school, the student is positive, or if you have a parent that calls the school and says, my child has been tested and is positive, you are going to be reporting a laboratory confirmed COVID-19 case, and you click on the first radio button, which is labeled a laboratory confirmed COVID-19 case. There is a second radio button, and it's for reporting deaths, and I hope that none of you ever have to report a COVID-19 death, but that is the second radio button. The second scenario which you will likely need to report are when you have an ill student. And remember, in the past, up till today, we had asked you to report ill students with one or more of those major symptoms of COVID. So the major symptoms of COVID, again, are the new cough, the shortness of breath or the difficulty breathing, and the new loss of sense of taste or smell. But now we only want you to use the report card to report ill students with that major symptom of COVID, that is the new loss of sense of taste or smell. Again, because this symptom is very, very likely COVID. You would use the third radio button to report this. And the third radio button is very wordy, but it includes individuals that have compatible COVID-19 symptoms and one or more of the following, which is a close contact with a known case of COVID, or a member of a risk cohort as defined by public health during an outbreak. And your schools are part of this risk cohort group. So you would click on that third radio button. So now we're asking questions again related to this case that you are reporting. And remember that this report card is used by many other providers. Again, it is not specific to school, so some of your answers will be unknown or no, and that's perfectly acceptable. The first question that you'll be asked is, do you plan on testing this patient? For the most part, you're going to be answering this with a no. But I wanted to show you what the form would look like if you answered yes, because in the future you may be testing students at your school using those point of care test kits. So if this occurs and you answer yes, you would get another drop-down box, and we want to know whether or not you're going to test the student yourself, send it to a commercial lab, or send it to our ADPH state laboratory. If you're going to be doing a point of care test on this student, you would choose the third radio button for clinical laboratory at this point. And we will likely update that third button to say something like clinical/in-house laboratory to make it more clear. The next set of fields have to do with the student and staff's demographics. It's really so very important for you to complete this section in full. We absolutely need to be able to contact the patient or the patient's proxy, and the only way we can do this is to have this information. So again, it's all related to their name and their phone number and their address and all their demographics, their age, their gender, all of that. Clinical information is, of course, also important. And again, remember, this report card is used by many different providers. But for you, if you are reporting an ill student, that ill student should have that new loss of sense of taste or smell. And you're going to choose yes. Did this patient experience COVID-19 compatible symptoms during his or her illness? By choosing yes, you'll have to choose the symptoms. There's a whole list of symptoms. The major symptoms and the minor symptoms are listed. Please select new loss of sense of taste or smell and any other symptoms that this student or staff has. But again, if you're using the report card, we need to have that new loss of sense of taste or smell as one of the symptoms.
Kelly, and Dr. Landers, can you hear me?
Yes, I can hear you, Carolyn.
Okay. So let me just, if I may stop you, because we're getting some questions, so I just wanted to clarify before we moved on. So people are a little bit concerned and a little bit confused. The person who has a new cough or who has the new shortness of breath, hard time breathing, Dr. Landers, those people are still, please tell us how those people are handled and then tell us about the report card. For the ones that are not the close contacts, but the ones who are actually experiencing the symptoms.
Well, first of all, the guidance here has not changed in terms of symptomatology of suspects, okay? These kids that have severe cough or shortness of breath, and I'll talk about that a bit more in a moment, or new loss of taste or smell, or any of the other symptomatology that we have talked about, will continue to need to go home based upon their being ill. In other words, these kids are sick. They need to be evaluated. They may have COVID. They may have something else. And we're talking about suspects, okay? So it does not change the way suspects are evaluated and triaged and sent home. We are talking about the contacts of suspects that are not yet diagnosed with COVID or some other underlying health problem that's not related to COVID. Did that make sense? Thank you.
Thank you, Dr. Landers. And so, Kelly, if we just want to build off of that, we are still, because this is coming in on my questions, we are still, and clarify me if I'm wrong, we are still entering anybody who has a new cough in the report card, or no? Okay.
No. So again, with the changes that we've made, we want to concentrate on the reporting piece is what I'm talking
Right.
about. So reporting to our report card, those students, those ill staff and students that have that new loss of sense of taste or smell. Those are who will be reported to the report card. Sending them home and asking the parent to take them to a physician to be medically evaluated
Okay.
still stays the same. They will still go through that screening. They will still get that parent checklist that requests that the parent take their child to a physician for evaluation.
Right.
If during that evaluation, regardless of whether or not they have the loss of new loss of sense of taste or smell, if during that evaluation the physician diagnoses them with COVID or tests them and they are positive for COVID, they become a case.
Okay.
And then we would have to contact the school for the information on the contacts. But for reporting by the school nurse to the report card, the school nurse is only required now to report positive cases and those ill students and staff with the loss of the new loss of sense of taste or smell.
Thank you.
Does that make sense?
Yes,
Okay.
it does. Thank you.
So continuing on with the report card, we have some more clinical information to gather from you. And some of these questions, again, it's totally fine for a school nurse to answer unknown or no, because this report card is used by providers across the state. So there will be questions on the report card about hospitalization, about long-term care, about whether or not there's an alternative diagnosis. And again, it is completely appropriate to answer unknown or no. Underlying health conditions. Again, obesity, cardiovascular disease, and diabetes are risk factors associated with COVID-19 disease. And we need to know this information from providers. But as school nurses, you may not have this information. So again, you may be answering no or unknown. Epidemiologic exposures. These questions are important to us. This is going to show whether or not this ill person is a student from a university, a school, or a daycare. So we need you to answer that question. And when you answer that question, we want to know the grade, the year, and the class. This helps us identify whether or not an outbreak is occurring or if it's a sporadic case. Supplemental information. So we really want you to pay attention to this page, because here's where you would upload information that helps us identify the ill patient as to being a confirmed case or not. So this is where you would also upload your close contacts of that ill person or of that positive case so that we can contact them and get them in quarantine for the appropriate period of time. The supplemental information page allows you to upload several documents. What we are looking for are those close contact lists and the lab reports. A close contact is identified as someone that is within 6 feet of that case or ill person for at least 15 minutes. And this is over a period of time, so over the course of the school day, for instance. Since we are only wanting you to enter ill students with that loss of sense of taste or smell or a positive case, those are the only contact lists that we need you to upload. We don't need a seating chart. We don't need everybody that's in the classroom or everybody that was on the bus or everybody that was in the hallway. We only need the list of close contacts to that case. And another very important thing to mention here is that by uploading those close contacts into this case, we can associate those contacts with this case. We do not want you to submit a individual report card for every close contact, which happens a lot of times. We don't need for you to do that. It makes it very difficult for us to understand whether or not that is a ill person or a contact. So we don't want you to submit a report card for each contact. We just want you to upload those close contacts. And sending children home, again, Carolyn mentioned at the beginning of the broadcast that this is different. This is a change. We're trying to make sure that we're only sending appropriate students home for quarantine. The ill student will be sent home because they're ill and they need to be medically evaluated to make sure that they have COVID, or maybe they have another medical diagnosis which would leave them at home in isolation for a lesser or greater period of time. With COVID, it's 10 days, with that last day being fever-free for the 24-hour period with reduced symptoms. The contacts, however, are quarantined for a longer period than the sick child. So it's a 14-day quarantine, and we really want to limit the number of children that are being sent home. So again, the change is that you will no longer need to send close contacts home to quarantine for the minor symptoms of COVID or the two major symptoms of new cough and shortness of breath or difficulty breathing. But you will need to send them home for any positive case and for any ill student who has that new loss of sense of taste or smell. And we do rely on those parents to get their children medically evaluated so that physician can then submit a report card saying, yes, this is a case. I do think this is COVID. Or not submitting anything, and we can go back and check and discover that that child was diagnosed with a different illness, and we can get those kids out of quarantine. So that's what I have on the report card, and how to fill it out and where to find it, and I'm happy to take questions.
Okay, well, I'm glad you're happy to take questions because one just came in. I have a question about from a nurse in a district. I have not had any confirmation that the ADPH has contacted any student that I have entered into the ADPH report card. How soon are these students being contacted? So the nurses and superintendents will not necessarily know when we contact someone. Is that correct?
Correct. So what we do every day, we have an epidemiologist who has been daily going through all of the report cards, first of all, that come in, and we have hundreds coming in every day. And what we are looking for is to make sure that the report cards from the schools we're getting the right reports. So we have to find out whether or not the student is being reported because they have a major symptom of COVID and that there's a contact list with it. But again, going through them, we get a lot of reports that there's nothing listed for symptoms, there's nothing listed for a lab report, so we don't know what those students are being reported for. We look into our disease surveillance system for a lab report. If there's a positive lab report associated with that student, we match it up and we have an investigator contact the case and do the investigation, and along with that case is going to, that investigator is going to collect the contacts of that case, the home and household contacts and other people outside of the school. Hopefully they have that school contact list to contact those students and staff as well. But if they don't, they will call the school nurse and get that list. That's why we like to have it in the report card available for us. However, we don't necessarily contact all those contacts until we can confirm that it is a case. So we won't be calling back the school nurse to say, we've contacted your student and your cases. That's part of our normal routine investigations with COVID. They are signed out to many different investigators around the state.
And so I think, Kelly, this is an opportunity for us to also go back to that point, because I am getting several questions on this. When they are uploading the report card, that does not just include students, that includes staff also?
Yes,
Okay.
yes. If they have a staff member, a coach, a music teacher, somebody that comes in, a substitute teacher, and it's involved with their school, they should report a positive case, or if they have that new loss of sense of taste or smell.
Okay, and then we also had a question, what about if kids are on the bus for an hour and somebody has this new loss of taste or smell, or somebody has been around another positive, like at home, that you find out that the mom is positive. So it doesn't matter if they're on the bus or in the classroom. We want to be consistent, or if they're in an extracurricular activity.
Correct. So sports, extracurricular activities, clubs, being on the bus. The close contacts are those that are within 6 feet of that case or that ill student for at least 15 minutes. And that 15 minutes doesn't have to be at one time. That 15 minutes can be at different times during that daytime, that day that they're with the other students. So definitely an hour on the bus, those folks that are within 6 feet, and it may be even, Dr. Landers may want to speak a little bit more about a closed environment, but we hope that folks are masking up on the bus as well as in the classrooms to help stop that spread that in those smaller environments.
And Carolyn, what we've said on that for the most part is those children that are north, south, east, and west, at least of that child. And hopefully there's not been a whole lot of movement, and they're staying in their seats, and they're masked, as y'all said. But if it's on the bus, at least those children that are north, south, east, and west of that child that is either symptomatic or positive.
Thank you. Okay, I have, and this may be one for Dr. Landers, and I'm going to be coming back to you though, Kelly, so don't go anywhere. If this is about multiple tests, Dr. Landers, if an employee of the school is tested as a requirement for travel and tests positive, then tests again and receives a negative test, which test do they go by?
The positive test is positive. This is a very specific test regardless of which one is being used. So a positive test is positive. Now, if a person has a test one day and then 3 days later gets a negative test, the positive test prevails, and the isolation from the time of collection of the specimen that is positive. Thank you.
Thank you. This one is for Kelly. Kelly, if you are a close contact to a person with new loss of taste or smell starting 48 hours from the start of the symptom, they're asking about 48 hours, and I'm not sure that really is. So
They're asking about close contacts for that 48 hours.
yeah.
Right, so we look at 2 days before that onset of symptoms. That's a really great point. So that is within their incubation period.
Okay, and then we had one other question, and then I'm going to let you get to your last slide on the report card. Is exposure defined as being within 6 feet and 15 minutes for a person who tested positive for COVID or has the major symptom of loss of sense or sense of taste and smell only? And it's back.
Okay, so the answer to that question is the definition of close contact is within 6 feet for at least 15 minutes within that 2-day period prior to symptom onset, or if that is a positive case for COVID, for any of those major symptoms. It's a close contact. What's reported to us is that unique new loss of sense of taste or smell, and what we want you to send home are contacts of those ill with that unique COVID symptom of new loss of sense of taste or smell. So we aren't changing the definition of a close contact. We are changing what we think you need to report to us,
Right.
and what we think you need to send home for the quarantine period.
Dr. Landers, I'm going to ask Dr. Landers to jump in here from the clinical side, because I think this is an important point. That Kelly is talking about reporting through the report card, but Dr. Landers, I just would like you to talk again about the 3 major symptoms, just to help reinforce what Kelly's talking about. I'm getting questions right now about if a student who was recently sent home because the student had a cough, can we bring them back? And I think, Dr. Landers, I'd like for you to just talk about the 3 major symptoms and what they should do.
Right. And actually, let me address it just from all symptoms real quickly. What I want to remind people is that, first of all, when we're talking about transmission of COVID, we're obviously talking about crowds, we're talking about ability for close contact, and we're talking about closed-in spaces with, again, the opportunity for transmission of a respiratory droplet. Okay, so let's remind that with these students, whether they have major symptoms or minor symptoms, they're sick. They have an illness, and they need to be evaluated for that illness. And I think one of the challenges in talking to parents now is to have parents step back and remember that there are other illnesses besides COVID. But when these children go home with and again, it does not change the recommendation, children go home for the symptoms, the major symptoms or the minor symptoms, they're still going home. They're going home to be evaluated by their physician, whether that may be an over-the-phone, a telecommunication, or a COVID test as indicated by that clinical assessment. COVID-19, when you look at the symptom panel, is very broad. Fever or cough or shortness of breath or new loss of taste and smell probably accounts for over 60% of cases. But again, that's still a 40% that other symptoms can be. Now, the reason we are teasing out new loss of taste or smell for suspects going home and contact the suspect going home. Again, we're talking about suspects, not diagnosed. New loss of taste or smell is pathognomonic for COVID, which means, in essence, doesn't matter what the test shows, new loss of taste or smell, they've got COVID, because that's just not seen in pediatrics otherwise. But when we're talking about the symptoms, as far as cough, certainly that sometimes can be a difficult assessment. But if a kid has a cough, a new cough, a cough that is basically an uncontrolled cough or a problematic cough, then obviously they need to go home. If they have like one cough and go, one time, don't cough anymore the rest of the day, that's not necessarily a reason to go home, and that's where our nursing and our medical judgment comes in. When we're talking about dyspnea, shortness of breath, that's a subjective symptom. This is basically where people would say, I can't catch my breath. I feel like I'm running, but I'm standing still. I feel like I'm walking up steps, but I'm standing still. I feel like there's an elephant on my chest. I feel like my chest is being squeezed. I feel tight. I'm not getting enough air. Any of these things that you learned in nursing triage. It's what I remind people about shortness of breath is, for one thing, you see that more in older children. Younger kids might not be able to verbalize it as well. But if you have dyspnea, if you have shortness of breath, you know it. Okay, this is not something that, hey, I think I have shortness of breath. If you have it, you know it. Or if you've had it, you know it. You have that symptomatology that goes along with that. Now, obviously, in much younger children, we have to do physical assessment. Kids may be coughing uncontrollably or breathing rapidly or any of these kinds of symptoms. So, again, cough, dyspnea, or shortness of breath, and then new loss of taste or smell being what is currently termed major symptomatology. And what I want to remind people is that the change here is that we are no longer asking for contact of suspects to go home unless the suspect has new loss of taste or smell. That's when we're saying the contact needs to go home. Now, if kids are diagnosed with COVID for any of these symptoms, including the minor symptoms, sore throat, or headache, or myalgia, or vomiting, or diarrhea, if they're diagnosed with COVID, then their contacts go home. And this is all based upon the current science and current information, recognizing that things can change. So again, I want everybody to remember that we're literally talking about the change here being contact of suspects that have cough or shortness of breath that we were previously sending home. We're not sending those contacts of suspects home unless the suspect subsequently becomes diagnosed COVID. We are making a clinical diagnosis, if you will, with the loss of taste or smell being pathognomonic. Carolyn, I don't know if that answered your question or not, but I wanted to try to bring that into a clinical realm. Thank you.
Thank you so much, Dr. Landers. Now, I had an interesting question pop up, and this is both for Dr. Landers and Kelly, because we have students whose parents are diagnosed with COVID. The parents are COVID positive. So, Dr. Landers, would you address that from a close contact? And then, Kelly, I want you to address that from the report card standpoint.
Yes, thank you, Carolyn. If a child lives in the home with a diagnosed COVID case, the child is to be home quarantined from the time that the contact has been broken for a total of 14 days. Now, I refer to the term contact broken because I'm a TB doctor, but contact broken means that that child will no longer have contact with the case in the house. And that really includes a lot of elements, such as the case remaining in a separate room, preferably using a separate bathroom, not coming into the common area, not providing food or fixing food for the family, and basically not mixing in with the rest of the family. In some houses, you can do that. In some houses, you can't. I mean, I've had families that 10 people lived in the house, and 9 of them got COVID. So children who are contacts of their parents, again, you might not be able to quarantine in that home until that parent reaches that 10th day. In other words, they complete 10 full days of isolation. And then the quarantine for the contact does not start until the end of that isolation period. So conceivably, we could have people out of school for 24 days. Again, it depends on the living situation for that family. Kelly, do you want to clean my answer up a little bit?
No, I think your answer is perfect. I just need to add that regarding the report card, we would not expect the school nurses to report that student as a contact to their parental case, let's call it that. However, we really want to stress to parents that they need to contact the school to let the school know that their child is a close contact to them, so that that school can notify whatever extracurricular activities that child may be involved with, to make sure that that child doesn't attend practice and things like that. We aren't worried about a contact to a contact per se, but we do want to make sure that that child is not at school. And if the nurse finds out that that child is attending extracurricular programs or trying to come to class, they can contact the health department, and we will make sure that the quarantine order is issued to that contact, to make sure that they understand that it's also, there's a obligation legally for them to keep that child home. it's our sort of best practice of care to give to people to keep the other people safe, is to keep these close contacts away from other people and stay quarantined during that time.
And many times, Kelly, it is the children that will let us know that. So then we have to backtrack and call the parent and say, you know, is this actually the case? So, you know, we're trying to backtrack on those things, but particularly if, you know, it's a parent that we don't see often, or, you know, they're kind of not engaged as some parents are, then we may not know that except if the child tells us.
So when the child, so just so we know, Kelly, I'm going to go over this one more time. When the child's parent or grandparent or anybody in the household has had a positive test, that child needs to go home and stay home. And you don't need the nurse to necessarily put that in the ADPH report card.
We don't want them to put that in the ADPH report card, because if it comes into the report card, it'll be one of those situations where we have all this missing information. They don't have a major symptom. We don't know how to connect them. So we will do our investigative work on the parent end and gather those close contacts and make sure that that parent knows that that child needs to remain at home, and we will encourage the parent to contact the school to let them know, because at the same time that parent needs to be watching that child for symptoms,
Right.
and may need to get that child medically evaluated.
Okay. All right, I know, Kelly, I'm going to hold, we're getting a lot of questions in, but I'd like to just allow you to get to the reporter information slide first.
Right, so on the report card, the last slide that didn't forward a few minutes ago is the reporter information slide. So this is where you would put your name and phone number and your school's name and phone number, so that we can contact you if we have questions about the report that you submitted. So it may be a little bit confusing when you want to select what type of reporter you are. Are you a daycare center? Are you a student health or another? That's fine if you select student health. That's usually the universities that are selecting that, but it's fine if a school nurse selects that, and you can select other as well. That's fine. If you have a daycare after school care, that's appropriate as well. But what's really important is to give your name and your facility name and your phone number, so that we can get back in touch with you. Thank you.
Okay, well, I would like to go ahead. Dr. Landers, I think, Kelly, I may have some more questions come in for you, but Dr. Landers, I want to turn it over to you, because we have some common themes that are coming into our question box. First of all, it's a big one about doctors writing students and staff out of quarantine, even though they're advised to stay home. Can you sort of talk from the provider standpoint on these issues?
Yes, I can. And this is something that, as a physician myself and having spoken with many providers during the course of this pandemic, I understand the ongoing confusion that persons might have related to isolation and to quarantine, especially if they are asymptomatic. It seems to be difficult for people to understand that you can have COVID and be asymptomatic. But we now know that this could account for a significant number of cases, including, again, some pediatric studies I've seen as low as 16%, some I've seen 27%, some I've seen 40%, and adults certainly 40% or so. So I think we still have a lot of information to learn there. But again, to remind, when we're talking about writing people out of isolation or quarantine, well, first of all, isolation and quarantine are public health requirements. This is not negotiable. It is not optional. And I think sometimes providers don't get the information from a patient that they have been identified as a contact, and need to be in home quarantine, but nevertheless, we're physicians in the Alabama Department of Public Health too, and the isolation and quarantine comes under the authority of the state health officer or his designee. So again, we are physicians, and we have ordered isolation of a case and quarantine of contacts. Now, we can provide a home quarantine order if needed. I actually have one up on my screen right now that I'm going to have to provide to a contact of a case. So when we have urgent cares or physicians writing people out of home quarantine or even out of isolation, I've had that happen too, we have to remind that we as physicians and under the authority of the Alabama Department of Public Health, Title 22 of the Code of Alabama, have ordered this to occur. So persons cannot test out of quarantine, nor can they be written out of quarantine or isolation. And we're continuing to work with our general counsel on language for this so that persons can continue to understand the public health requirement on that. And again, I talked to 2 nurse practitioners today whose families came to them. They did not understand. They thought they were not a contact of the case because they thought they were contact of some other person. Okay, we can't divulge that information about the identity. But again, when you are getting a lot of physician and nurse practitioner orders, well, we as the health department, under our authority, have already required this person to be in isolation and quarantine. So the provider cannot write them out of our public health requirement. Thank you.
Okay, on the same theme, what if we have doctor offices sending students back to school with no diagnosis or just writing return to school even if COVID negative? If no other diagnosis is given, are they not supposed to stay out 10 days if no known diagnosis? So these are doctors writing notes that the nurses are having trouble figuring out what to do.
Right, and as a physician myself, again, looking at the spectrum and the symptomatology here, and having had to carry a caseload of COVID patients, I certainly get where these physicians are coming from. But again, if a person has symptoms compatible with COVID and they are tested and they don't have COVID, then that physician or that nurse practitioner is going to have to diagnose them with something, okay? And I mean, if I see a person and they don't have COVID, again, they have some reason for their illness. So that's the question I think that comes up, is that physician or nurse practitioner has committed to some diagnosis there with this person, even if the diagnosis is viral respiratory illness not documented to be COVID, okay? So, I mean, that's where if they're negative and their symptomatology has improved to the point that they are no longer ill, and that includes no fever, no cough, shortness of breath, then really it may take 10 days for that person to become well. But my thought process is that physician or nurse practitioner needs to clarify for if they're negative, then what do they have? They've got to have something.
Thank you.
But Dr. Landers, let me comment on that. Many times physicians don't write that for school nurses. Sometimes it may be at the parent's request. The parent may say, I don't, particularly care for the school to know what was wrong with my child. So I think a lot of the times they will just write that note. Many of them have standard notes where they check okay to return to school. And so as we've discussed in the past, it's hard because nurses are obligated to follow physician's orders. And if we don't have that written public health order in front of us, then that's when we end up calling Dr. Landers and she has to call the doctor, which she's been great about, and we'll continue to do that. But I just want to make sure that, you know, while we say we know a physician should not do this, they are doing it.
Well, we're getting ready to put another HON out. So, you know, I guess my diagnosis would be not COVID. You know, if I were the physician sending this person back, I'd say, no, they don't have COVID. That's my diagnosis. Because they had a COVID test, it was negative, they don't have COVID. If I'm not making any other diagnosis, my diagnosis is not COVID. Now, again, let me go back to the symptoms of new loss of taste or smell. These kids have COVID, and they should not come back to school until 10 days after their onset of symptoms. And, you know, again, no fever, no other symptomatology, but if they've got new loss of taste or smell, they've got COVID.
Thank you.
I hope that helped a little bit, but we're going to work on a HON on this and do some more clinical education with our medical providers. I don't think most of them are trying to be a threat for us, but they're all dealing with the same thing we are.
Thank you. So I do have a question. I don't know if Kelly or Dr. Landers wants to answer this. How does someone report people breaking the isolation or quarantine rules? Community members are reporting this to school nurses, but we are unsure of how to handle this.
Ellie, do you want me to take that, or do you want to take that?
You can go ahead, Dr. Landers.
Okay, well, this is what I tell people, because I get the privilege of working with 64 of 66 counties, but sometimes I work a little bit with Jefferson and Mobile as well. I tell people, if you report that so-and-so has COVID or has home quarantined and they're breaking quarantine, provide that information to your infectious disease and outbreak nurse in your district. Now, we will follow up on that, but we will not tell you the outcome, okay? Because I've had people report to us that someone had COVID and they did. I've had people report that someone was in quarantine and they completed their quarantine. So we will not go back and say, okay, this is, in other words, we will either clear them to return to school or have them go back into home quarantine if they're breaking quarantine. But again, we're not going to necessarily tell you on every one of these if they're not specifically related to the school setting, but we will clear them to come back or not come back as appropriate. Does that help?
That does help. Thank you. Okay, I want to just to reinforce what Kelly and what we presented on report card. I'm just going to throw one out there. Student or staff has developed a new cough or shortness of breath or difficulty breathing. What should the school nurse do? And I'm looking at Jennifer, but she's not volunteering. So, Dr. Landers, do you want to take that? So we have a student or staff member who has developed a new cough or shortness of breath or difficulty breathing. These are two of the major symptoms we are now treating a little bit differently as far as the report card and close contacts. But can you go through what a school nurse should do?
I can take that if she wants me.
Okay, Jennifer's going to take a crack at it. Thank you.
So I would do just what I would have done pre-COVID with that person with COVID on my mind. I would assess them. Are they running any fever? How did they feel yesterday? Any other symptoms, any body aches? And I would let that person go home and see their provider. You would not put that in the report card at that time because that is not loss of taste or smell or a positive case. And I would have that person call me after they see their provider, and if they call me and say, "Ooh, Miss Jennifer, I'm positive," then I would immediately go put it in the report card and start contact tracing. If they say, "I went to the doctor, he said that my test is pending," then I would say you need to stay out until those results are back. If those results come back in a few days and you're feeling better and he says you've got a viral illness or you had bronchitis or whatever, then you come back to school. And you never report that in the report card.
Correct.
Yeah, she got an A. A plus.
Yay.
Yay. Okay.
To reinforce what Jennifer said, and Jennifer, thank you for that, reminding people, if people come in and they're coughing, and they're short of breath, as Jennifer said, you get your information, but, they need to go on and be seen. I mean, this is not something where people, oh, I've got cough or shortness of breath. I mean, again, especially in an adult, that could be a lot of other different things, and we certainly don't want to minimize that. And I worry very much in COVID that people have focused so much on COVID that they have even delayed going to the emergency room for other symptomatology, or delayed going to the doctor for other symptomatology, because they think, oh, well, this is COVID. It turns out to be a pulmonary embolism or a heart attack, something like that. So again, this would be in adults, of course, but at the same time, just to remind, I mean, we would have done the same thing before COVID. People have symptoms, they need to be seen. Thank you.
Okay, now I have one that's sort of a combo. If we have a student that we send home sick and parent takes them to the doctor and the test is coming back within 2 to 5 days, do we have to send in a report card before we get the result in?
So I think that's a trick question.
Yeah.
Did you send that student home with the loss of the sense of taste or smell?
They didn't say.
They didn't say. Mm-hmm. So we'd have to call back the nurse and get the information as to the symptomology. What symptoms did they send them home for? So again, we really are depending on those nurses to report to us when that child has or that staff or student has a new loss of sense of taste or smell to the report card. And then with the other symptoms, doing their assessment, sending them home for the medical assessment by the physician.
Okay, we have a couple of minutes left, and minor symptoms are coming up also. So we have student or staff with 2 minor COVID-19 symptoms. One of the questions is report card, and we have not done report card for minor symptoms. Is that correct, Kelly?
Correct.
Okay. So there's no report card on minor symptoms. And the other thing that we don't do is we don't send close contacts home of those minor symptoms.
Correct.
All right. Those were 2 questions. Let's talk about teachers as essential workers. Dr. Landers, we're going to sort of close out with that. Would you like to talk about that? And then I have one more question after that. Did we lose Dr. Landers?
Sorry, no, I had to find my mute button.
Oh.
Okay. Sorry, I found my mute button. I think when we look at teachers as essential workers, all of us know that teachers are very essential to what we're doing, and I have tremendous respect for teachers. At this point in time, CDC has not, specifically provided a change in their guidance as far as teachers. So until CDC changes their guidance, we will not change ours. We do think we have to remind with essential workers, persons that are contacts for essential workers currently are in the healthcare, I guess you might say the healthcare industry, first responders, nuclear power plants, those kind of situations defined by Homeland Security. But if teachers are determined by CDC or deemed by CDC to change, then we will remind that persons with symptoms cannot work. And any other guidance will be based upon what we receive from CDC. Thank you.
Thank you. And one more question, and then we're going to have to go to a close, unfortunately. So we sort of have a change in how we look at positive teacher, people who have had COVID in the past, whether they're a student, a faculty member, or staff. So if you've been positive and have had a positive test, you go into isolation. When you come out, if you're exposed again, Dr. Landers, what is the new guidance on that?
Okay, and again, let's make sure I turn my mute button off. Basically, what we're looking at when we're talking about persons that have had COVID previously and then are re-exposed in less than 90 days. Okay, we don't know about the immunity to COVID at this point in time. We believe, based upon some information, that persons may test positive up to 90 days or longer. Currently what we're doing is that if a person is a contact of a COVID case and they've had COVID in less than 90 days, we do not require re-quarantine of that contact unless that contact develops symptoms. Now again, be aware that that can change, but that is the current information on the CDC's website at the moment. Thank you.
Thank you. And I'm continuing to get a lot of questions in, and since we are now at 4 o'clock, what we will do is we will review the questions that have come in and hopefully get back with you. Jennifer and I talked about having school nurses maybe every 2 weeks, and Dr. Landers and Kelly also talked about this, and that maybe we can set up conference calls every 2 weeks and have discussion with school nurses about new situations that come up or to clarify things. So if you all think that's a great idea, let Jennifer Ventris know, but we would love to do touch base with our school nurses more often, since this is such a fluid situation with COVID, and since it's been going on since March, which is a lot longer than we all had hoped it would go on. But we're here for you. We appreciate you joining us. I certainly appreciate our faculty today. I'm calling y'all faculty. Dr. Karen Landers on the phone, and Kelly Stevens here with me in the studio, and then also Jennifer Ventris is backing us up. We also have Jennifer O's, who is part of infectious disease, and she is also working with the report cards and may talk to you all. We have Bill Kennedy, who is our social work director and is supporting us in this effort with COVID. And we have Teresa Dix, who has just joined the team working on COVID. So we appreciate you all every day. We are here for you, and we will set up in 2 weeks. I'm looking at Jennifer, a conference call, and we will have our experts here. And we just thank everybody for joining us today.